This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
Hey, welcome back, everybody. Cosmetic surgery has gotten extremely popular in the last few years, and results can be fantastic, but the healing and the results could be better if you were to also do this one thing. Well, actually, you wouldn't do it, but somebody would do it for you. I'm referring to lymphatic drainage massage. I'm going to start with that today. She is our, by far, expert, president and owner of Boone Lymphatics and Massage Therapy. Learned so much ever since we've gotten together with her on this very important system in our bodies that is many times overlooked. And Boone is back on the program. How are you doing today?
I'm doing well, Steve. Always happy to be here and talk about these things that so many people have questions about, and it's not kind of a mainstream discussion necessarily.
Should there be lymphatic drainage massage after pretty much every surgery, or if we want to say every major surgery?
There are so many factors that play into that. What I will say is that in general, not knowing what anybody else's health issues are, like high blood pressure, any of these kinds of things that we would also look at. But typically, lymphatic drainage can be very, very helpful after any surgical procedure, knee replacements, hip replacements, shoulder replacements, anything like that. But especially cosmetic surgeries, it kind of came to light and fell in my lap in the last couple of days. A client who they are in this business and are involved in medi spas and things like that, and they were asking me. They were discouraged. They're only a little bit out, not many weeks out, and they were discouraged because they were still in a lot of pain from what we call a mommy makeover. So it's a tummy tuck and breast augmentation,
Yep.
And so they're tucking everything up there, and her doctor had specifically told her that lymphatic drainage wouldn't do anything for her. Now, what I find is that doctors in this area, in Lexington, Kentucky, and in some other areas, don't have a lot of exposure to the post-op cosmetic lymphatic drainage, and they call them lymphatic massages. You go to some place like Miami or out of the country to the Dominican Republic, Brazil, where these are much more prevalent. It's a given. They give a whole list of what to do. So we're in the middle now of educating and convincing surgeons here, because we would love to have our clients have their surgeries in town. Because if you have a complication with a tummy tuck, which is major surgery, it's like an extended cesarean almost without going deep into the abdominal cavity. But if you have a surgery like that here, or even with the breast augmentation, you have a complication, no doctor here is going to touch you. They're just not going to do it because it's somebody else's surgery.
Wow.
So the prevalence of this has gone up since 2019. Just cosmetic surgeries in general in the last decade have gone up. Since 2010s, it have gone up almost 50%. And those are surgical procedures. A lot of cosmetic procedures are, the prevalence of cosmetic procedures that are non-surgical would be Botox fillers, minimally invasive surgery or procedures like that. Those are very prevalent. Surgical procedures are about 1 to 2% of the population. And some people have more than one procedure, so they're counting just all of the procedures. So during the pandemic, I saw a huge rise because I think that people were home alone. They could heal on their own without having to go out, those types of things. But I've noticed a huge increase since 2020 in these procedures and in trying to educate people about why they're important.
Now, there's two things I'm seeing that is going on here. It's feeling better, less pain, but also the cosmetic result. And you're having cosmetic surgery for a reason. You want the best look. So doesn't lymphatic massage support both of those?
It does. Um, and you're freezing up a little bit on my end here. I'm not sure why.
You look great.
Let's see here. But yes, so, okay, awesome, good, good. That's all that matters. Um, just kidding. So yeah, the biggest problem is that, and you and I have discussed this very briefly, a person has these procedures and they're not cheap, they're expensive, but they're not educated on the fact that there are expenses and healing that go on once you've had those procedures. And so the marketing of these procedures, a lot of times people aren't willing to put in the extra cost because you're going a couple times a week. In Miami, they have people go every single day for a week or two after their surgeries, and then they stretch it out from there. And most people don't stay in Miami for more than a few days. So educating people on the fact that that's just the beginning. The surgery is really just the beginning of the process. And now they've damaged your lymphatic system by separating your skin and sucking fat out. And then also getting people the idea of this client here, the doctor told her not to wear any kind of compression. She's wearing a waist binder, which is very common, but that pushes all the fluid down towards your incision, down towards your legs, and that's what she's having a problem. She said she's gained 17 pounds, and much of that might be fluid. So she's she's very frustrated, which is normal. But you have that fat being removed, which is going to have an effect on your hormones because estrogen is stored in fat.
Wow.
So we have to sort of talk people down off the ledge about we call it the 2 or 3 week sort of effect, where they're questioning why they did this. They're angry at themselves or the surgeon. They don't like the results. And it's a marathon, not a sprint. So it's going to take at least a year or so to see the results you really want. It's going to take a while to heal. So having said that, a lot of times like her doctor in particular told her not to wear any kind of compression. So normally we would have them go into what's called the faja, which is a full body compression. So once you've had that skin separated and your lymph damaged, which it's right under the skin, it's having a hard time trying to figure out where to reroute to. So manual lymphatic drainage helps that reroute, and then the compression supports that technique and that procedure, that modality. So compression is crucial for these people. And it's just getting the surgeons on board and getting them to understand that this is going to make your work look better. This is going to make your clients more comfortable quicker, and they're going to heal a lot better, and they're going to heal a little more quickly.
So when you talk about the rerouting of the lymphatic fluid, once you reroute it, does it remember to go that way in the future, or that you have to continually have that kind of therapy?
That's a great question. So what happens is the vessels have been damaged. So the vessels bring lymph to the lymph nodes, and these vessels are recreated. So they actually form new vessels. And over a period of time in the beginning, it's important that we keep encouraging the lymph to go the new route. And then once we've encouraged it enough and those vessels have started to, we call it lymphoangiogenesis. So once they've formed new pathways, then the MLD does not have to be done as frequently. But in the beginning, whether it's cosmetic surgery or especially a woman who's had breast cancer or anybody who's had cancer and lymph nodes removed, we have to reroute everything to the new way of flowing.
Wow. Why do you think more cosmetic surgeons don't talk about this? Because healing is important to feel good. Certainly the cosmetic result is at stake here. What do you think's going on?
I've seen this with oncologists too. I had a client years ago who had double mastectomy, no radiation or chemo, and came in, I think I might have talked about this last time, but came in with swelling in her upper back, and she wanted a deep tissue massage. And this was about 25 or 30 years ago when I first started studying lymphatic drainage, and I didn't feel equipped to, what I did know is that looked like lymph fluid, and I was not going to do deep tissue to it because it could have really caused an issue. So I took her to a physical therapist who did know about this, her oncologist specifically told her, don't do lymphatic drainage because you'll have to do it for the rest of your life and you'll have to have the bandaging for the rest of your life, which is not accurate. But I didn't want to say that with my limited knowledge at the time. So when I took her to the PT told her that was BS and it was the opposite. So I let the PT do the dirty work, you know. So I think it's about education. I think it's the same reason that doctors don't recommend nutritional pathways for health and that type of thing, because they have about an hour to 10 hours of nutritional training. So I think it's about education, and they just don't know enough about it. And as well as, and I understand this completely, things like a tummy tuck, you have to be careful on how you're working around that. You can't pull on the skin. You could open up their work, and that would be really a problem. So I think it's really mainly, more than anything, it's just education, that there are many, or at least a few here in Lexington, who we have the training to actually do this work, and we want to collaborate with surgeons.
Do you think that many surgeons, especially cosmetic surgeons, aren't going to mention this type of therapy because it's just going to add to the cost of the tummy tuck, the mommy makeover, and then the patient's going to see, oh, well, they're suggesting that I have this done. They don't do it. I'll have somebody else do it, but it's an added cost.
I see that point. And again, I think it's about the surgeons educating their patients, first of all, to schedule these sessions when they schedule their surgery. What we get a lot of times is people find out about it afterwards, and they call us a week after they've had their surgery, and we're booked out, with people. So I think it's about educating the surgeons to educate the patients, and about what proper lymphatic drainage looks like. Because I hate to keep railing on Miami, but this is where we're getting a lot of the patients that are coming in, and they've had something that didn't even resemble lymphatic drainage. It was aggressive. It was painful. It was not done in the right way. So I think, again, it goes back to education, because I think if somebody is doing their research and not just doing it on TikTok or Instagram, but looking into real research on PubMed, things like this, and there aren't a lot of lymphatic studies, especially for cosmetic surgery. But I think, again, it goes all back to educating people, because they think, oh, I can go down to Miami and get a cheap surgery. And then, like you said, they're not budgeting for what comes after. And the fajas are anywhere from $100 to $300 a piece. You need at least two of them. Those kinds of things. So I think it goes back to education, because if you're going to drop that kind of money on a procedure, a lot of people who've lost 100 pounds, they want to get rid of that skin. So, educating people that this is really part of the whole package.
Now, you mentioned before about people, it could be anywhere, but you mentioned going to Miami and it's being too harsh and rough in terms of the lymphatic massage. When somebody comes before you, are you able to tell that, wow, they had it done before, but it wasn't done right? Can you tell?
Well, first I can tell because a lot of times they're sitting in my chair and they look terrified. And I'll ask them what's going on, and they say, well, the other person really hurt me. Are you going to do that too? Yeah. So it's really about education. As I mentioned, I've got my little lymph fellow back here our charts that we educate people about what lymphatic drainage really is and why it's supposed to be gentle and why we're doing things in a particular manner. I can also tell if a person has had aggressive liposuction, if they've had improper compression, because they might have what are called lipo or faja burns. And I mean, it literally looks like a burn on the skin, to where they have, for lack of better terms, when they heal, it looks like a potato chip, that kind of like where you've had road rash. When somebody has had really aggressive liposuction, or they've been treated, big trend with treating with machines after surgery. So people will get radio frequency. These are advertised all over the internet.
Sure.
And that is not good, because you're adding heat to a system that needs to not be heated. So we'll see fibrosis. We'll see areas of puckering, areas of hardness. where the fluid has just stagnated and has not been moved properly. So, but one of the biggest things I see with new clients who've just had surgery is they're terrified.
Wow.
They've been abused.
And I could see, these different, there's all different names of them, radio frequency. Sometimes they use, they cool the skin, leave it at that, freeze it,
Full
if you will.
sculpt, yeah.
Yep. So I can see, somebody just maybe gets a little hooked on it, where it's like, all right, I had this done. Oh, let me just do that now. Let me do this now. But bypassing the lymphatic massage, and to your point, I've had it done before. Super light touch. It's almost to the point where I thought, is this really doing anything? It's so light. It was very relaxing, though, I got to say.
Yeah, no, it's and again, it's what's being thrown at you through the algorithm. So if you're somebody looking up a lot of things about cosmetic surgery, you're going to get all this radio frequency and all
Sure.
of these compression boot things, or pant things that you put on, which are really better for venous issues, not lymphatic issues. So you're going to be bombarded by all of this marketing that is marketing. It's not really it's not accurate in what needs to be done right after surgery. So people do things they don't know. They do the best they can. They do the best research they can. They ask friends that have had these surgeries, but it's going to be different for every single person. And yeah, so I mean, it's a conundrum for us because it is a lot about education, and we have to make sure that we're staying within our scope of practice. So I'll send them to a nutritionist, or just let them know what has been suggested as far as salt intake and things like that, and to talk to their doctor. Because I
Mm.
think we talked last time about the fact that if somebody has high blood pressure or low blood pressure, and I'm not a nutritionist, I'm not going to make recommendations on salt intake. So, but that can affect the effects of the manual lymphatic drainage and of the manual lymphatic massage in general, and their healing as well.
What do you want somebody to know who's considering cosmetic surgery?
So I would say that you want to make sure that you find somebody in your area, if possible, that can do the surgery. It may be a little more expensive, but you get what you pay for. So if you're trying to do bargain discount massage therapy, or bargain discount rather cosmetic surgery, you're going to get what you pay for. Often the surgeons ghost the person afterwards, or they give them ridiculous suggestions like have your massage therapist or your boyfriend drain your seroma like a pocket of fluid, which is it puts you open to a lot of possibility of infection. I would also say budget ahead of time for what you need. And also, don't think you're going right back to work or you're going to go on a cruise 2 weeks later. These are major surgical issues, and that your procedures that you're having. Make sure you have somebody to help you, go down with you, and then also, help you when you come back, especially if you have children or anybody else to take care of. This is not just going down, and I mean, you can't stand up straight for about a week. You're in a lot of pain. You're on pain medications. You probably won't be able to drive for a while. So there are a lot of considerations that the surgeons might just say, "Oh, you're good to go back to work in a couple of weeks." You may not be.
Mm.
So depending on what you do, you won't be able to. If you have small children, you won't be able to lift them if you have a tummy tuck, or even breast augmentation.
So let's focus on tummy tuck. Let's say somebody had one.
Mm-hmm.
On average, how long should they have lymphatic massage for? And maybe, number of sessions, maybe once a week for insert amount of time on average.
On average, depending on the person's healing, we'll have them come a couple times a week for the first month. And the other places will talk about 3 times a week or even more often, but a couple times a week is what most people can handle financially and time-wise. We can even stretch it out to once a week. Usually that is the first 4 to 6 weeks, maybe up to 8 weeks. And then after that, we go to once a week or once every other week. And we have to really sort of gauge how their healing's going. If the main thing is patient/client compliance. Are they moving? Are they wearing the compression? Because the compression, especially as the weather gets hotter, people don't want to be wearing a full body girdle, basically. And they didn't think about that. So I suggest my clients have their surgeries in the fall so that they can heal over the winter and not have to, wear these things in 80 to 100-degree heat. So, but yeah, that would be the main thing.
And is it reasonable to think that you'll see a better cosmetic result in the incision area if you have lymphatic massage?
Generally, and we are also able to, when the incision is well healed, we are also able to do some cupping and some other things on that incision to help it not become keloided. There are other things they can do, like putting silicone tape over the area, which tends to help with flattening the scar out. You hear about people talking about breaking up scar tissue. Okay, that's another thing, like toxins that are talked about in this business a lot. You're not breaking up scar tissue. You're not breaking it up. We're just trying to create more shear between the layers so that there's movement again. You want it to heal and you want it to bind down in the beginning. So we're going to be very careful about that incision until it's fully healed. But there are things that we can do besides lymphatic drainage around that. And then also I'll do some cupping once a person is probably 8 to 12 weeks out. I'll do some cupping on their abdominal area and their flanks and things like this. So, but it's very individualized. We take a very thorough history, and then we monitor the clients along the way and make sure that, some people may go 12 weeks with lymphatic drainage, be great. And then they're good on their own. We also give them some self things that they can do, a little bit of dry brush, but dry brush massage that comes on later on. And but it really depends on patient compliance with their compression and with movement and all of those things. I could do all the lymphatic drainage in the world, but if you're not wearing compression or you're not taking care of yourself in the other ways, we give clients a pretty extensive list of pre-op and post-op considerations.
Dry brush.
Another one is not smoking.
Yes. That can dry you out. While we're talking about that, dry brush, you mentioned that once before. Yes. Are you actually using a dry brush?
You are actually using a dry brush. You're using a natural bristle dry brush. You see these bath brushes that have a handle, and often they're wooden. And excuse me, so a dry brush massage, you want to be moving distally, so furthest out from the body to proximal, towards the armpits, towards the inguinal area, depending on what kind of procedure you've had. But you don't want to do this too early because, again, we're trying to reduce the inflammation and any kind of what we call hyperemia. So when your skin gets really red on the surface from having it rubbed or sometimes from massage, we don't want to create that, especially in the early days of lymphatic drainage. So as they move along, they can start to use some dry brush massage, which will help stimulate lymphatic flow. It's also good for skin health, so skin care. With these surgeries, it's really important to take good care of your skin as well, because it gets very dried out under the fajas and everything. So, yeah. So you do it before you shower. Usually, do a little 5-minute dry brush.
That just demonstrates how delicate this is, or can be, where the massages with a brush. Like, oh my gosh.
No, and it's very light. You're not doing it hard. You're just trying to stimulate the your sensory receptors in the skin, which are going to stimulate the filaments that open up the capillaries of lymph, the very beginning of the system. So it's a whole thing.
Yeah, there's a lot going on here that many of us don't realize, including some cosmetic surgeons. Just gonna say. Yeah. And
we know what we know. We know what we know.
It's all about proper healing, feeling better, less discomfort. You are by far amazing in this, and it spreads every single time we get together to cosmetic. Now we're talking about cosmetic surgery and your knowledge there. Never thought we'd ever be talking about that, connected to lymphatic massage. How do we connect with you? What's the best way?
So that you can go to my website or our website at BooneMassageTherapy.com, BooneMassagetherapy.com. Excuse me. Or you can call 859-209-9005, and that's a virtual receptionist who will take a message and we'll call back. And yeah, you could schedule in that way as well. You can schedule on our website.
Amazing. Thank you for the insight. You're, of course, in Kentucky, so you got to be
Yes.
there, physically present, but
Right.
you're also an amazing, valuable resource for the rest of us if we're not in that area. And I truly appreciate it. Thank you, Ann.
Yeah, thank you. I really appreciate it. And people can contact me to find providers in other areas.
Beautiful. We'll talk soon. We'll be right back.
This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.